Namaste. I'm Dr. Darshan Angadi and I'm a consultant orthopedic surgeon at the United Hospital in China. I look after patients with ligament injuries and complex joint problems. And one of the devices that we tend to use in patients with knee problems are referred to as braces and splints. And we've had some patients with queries. So in this video, we'll try and cover some of the basic concepts and designs of these splints and braces we use for patients with knee problems. So in general, splints are devices that are used for a relatively shorter period of time in patients who are recovering from either ligament or bony injury to the knee joint, or who recently had a surgery on their knee joint. In contrast, braces are devices that are designed to support the structures in and around the knee joint and are often combined with physiotherapy and rehabilitation exercises to strengthen the structures around the knee joint. So we have here some of the commonly available devices in braces and splints that are used for managing patients with knee problems. The commonest design that you tend to see is referred to as the Knee Mobilizer. It is referred so because it's a rigid splint and it does not permit any bending at the knee joint. And this lack of movement is used to our advantage because it allows the soft tissues and the structures of the knee joint to heal and recover, either following a ligament injury or after any recent surgery on the knee joint. The next commonly available design is referred to as a hinged knee joint. As you can see, it has a hinge joint here that would allow for the bending of the knee joint, and it has aluminum struts on either side which provide a functional support from side to side movement for the patient when they use them after wearing them during their day-to-day activities. The next design is a fairly robust one and is referred to as ROM or range of motion brace. As you can see, it has a circular dial-like device built into it along with these struts on either side and the Velcro straps. What this device does is it allows us to control the amount of bending that the knee joint goes through when the patient uses them, either following injuries such as the anterior cruciate ligament or ACL, or after recent surgeries on their shock absorbers or the meniscus inside the knee joint. The next type of devices are collectively referred to as sleeves, and some of the designs are here, and they are often made out of elastic material which provide circumferential compression to the knee joint, and thereby it reduces the swelling and also helps to provide pain relief to the patients. Some of these also have a built-in ring for providing support to the patella or the kneecap, and we tend to use these in patients who have kneecap arthritis or wherein the cartilage behind the kneecap tends to thin out, which is referred to as chondromalacia patellae, or also wherein the kneecap joint itself has abnormal shape or morphology, referred to as patellofemoral dysplasia. And the other common band-like structure that you tend to see is referred to as the patellar tendon support. And again, this is used on top of the patellar tendon and provides compression and support when patients recover from the patellar tendinitis, which is quite often a painful condition, and they have to do rehabilitation exercises with the help of physiotherapy along with medications. So as you can see, most of these braces and splints are manufactured from modern materials including neoprene. They are also lightweight and are quite often user-friendly because you can take these off for hygiene purposes. Your doctor or your surgeon would normally recommend one of these depending on the condition you have, and also would suggest the duration that you need to use them for. So if you have any further questions or queries, please feel free to contact us on the information displayed on your screen, and we will be happy to answer your queries. Thank you for your time and attention.